Thank you, Scott. Okay, as Scott said, I'm Dan Sullivan. I am a case manager here at Senior Resource Center. We're going to put on some PowerPoint slides here. I'm going to be going through some things, just some real basics about Medicare, so you have a better understanding of the components that make up Medicare and the parts that are important to you. So you can be a more educated consumer. I imagine that you've been bombarded by Medicare mailings. Uh, they get a little crazy this time of year, but rarely have I ever seen an advertisement or any kind of booklet that really explains the parts of Medicare and what's best for you and what you need. So this is an overview. So it's not meant to be just like this is the plan for you. I'll have resources at the end that will help you find that kind of direction. There are people out there that can help you get to that plan that meets all of your needs. And you have a good understanding at the end of that what those costs associated with that are or could be. So right now, let's jump in. I'll bring up Scott. I think I need you to allow screen share. There we go.
Yep.
Bring up the presentation and all right. We good, Scott? Does that
Yep. Perfect.
Okay, good.
You're...
All right. So here we go. Sorry, let's start at the beginning again. So this is everything you need to know about Medicare Open Enrollment. Just a little bit about Senior Resource Center. So we are a elder care advisory. Sorry, this is jumping around. An elder care advisory group. We actually bring together three disciplines, primarily elder law. We actually have 7 elder law attorneys here. They're attorneys that practice specifically with estate planning with elders in mind. And we also bring together case management. That's myself. And we also have one of our attorneys who's actually a registered nurse as well. And we do a lot of planning around that. When people come in, it's not just here's what you need legally, but here's what your legal needs are based on what your care needs are or may be. So it's really all encompassing. And we also bring in financial guidance as well. So we make sure that people understand the types of benefits that they may be eligible for or how they may become eligible. And we also have a financial planner on our staff who can help people figure out, based on their care needs, and their assets, how that's all going to work. So let's jump right into Medicare. So I'll give you a few, we'll go over this and just hopefully try to get you to understand the various parts and how they interact with each other of Medicare. So here we've got original Medicare. You may hear that term. And again, to understand, Medicare is a federal government run program. So it's different than Medicaid. Medicaid is a federal program and it's run at each state level. Here in Massachusetts, it's called Mass Health. So you may hear Medicaid and Medicare. Don't want to mix them up. We're specifically talking about Medicare. This is generally a health insurance benefit that most people are eligible for if they're disabled or when they turn 65. So original Medicare, that's comprised of Medicare Part A and Medicare Part B. Medicare Part A is often referred to as hospital insurance. It covers things like if you're hospitalized, you break your leg, you go to the ER, they stabilize you, you might have surgery, you stay a few days. All of that is covered by your Medicare Part A insurance. And then if you leave the hospital and maybe you got to go to rehab or you're getting rehab at home and you're getting PT and OT, and then you may have to go see your doctor for follow-up. Generally, those types of things are covered by your Medicare Part B, which you call medical insurance. It's usually the outpatient types of things. And then there are components that you can add to original Medicare because original Medicare itself, A and B, doesn't cover all the cost. Typically, you may hear that Medicare generally covers only about 80% of the cost of your care. And for most things, that's accurate. But so most people need to choose some type of a supplement to help cover that additional 20%. And different supplements cover that 20% in different ways and in different amounts. So some of them you get that entire 20% fully covered. Other ones, it covers components of it or parts of it, not in full. And so typically you might also hear about Medicare Part C. We don't usually refer to that as Part C here in Massachusetts, but those are typically Medicare Advantage plans. We'll get a little bit more into the details of that. Part D, you might have heard about. Those are Medicare prescription drug plans. And then we have another type of supplement here in Massachusetts, Medigap plans. And some states have, up to 10 different types of Medigap plans. Here in Massachusetts, we only have two. You're either eligible for one or the other, Medicare Supplement A or Supplement 1A, and we'll get into more of those details. So here's just another graphic that helps you understand how Medicare and other components interact. So again, original Medicare, Part A and B. Typically, people get it at 65, or if you're still working after 65, you may not need to get it until you retire and you kind of give up your employer-based health insurance. But either way, once you're on original Medicare, that's going to be the core of your health insurance. No matter what other supplement you may get over the years, original Medicare is always yours. That's a federal benefit, Medicare Part A and B. And everything else is a supplement that you add to it. You never want to give up or cancel any of your original Medicare Part A or B. There can be significant downsides to doing that, as well as financial costs. Then you can see we have here Medicare Advantage plans, Part C. Those are typically HMOs and PPOs, preferred provider organizations. You may be used to that if you've worked most of your life and you got employer-based health insurance. That's typically, they operate basically the same way. We'll get into more details. And then there are these Medigap policies. That's the Supplement 1 or Supplement 1A. We'll get into some of those details. And then if you do choose to get a Medigap policy, you also have to choose to get a Medicare prescription plan. And again, we'll get into the details of that. So Medicare Part A. The Medicare Part A is free. There's no monthly premium. Generally recommend people get it regardless if they're, continue to be employed or not. You can get it at 65 when you sign up. You can sign up through Social Security. It's free. Some employers may want you to get it, and then they will tailor the supplement around that. So you should check with your employer if you're going to remain being employed, what's the best options for you. And again, if you're covered by your private health insurance, it's more than likely here in Massachusetts, since insurance is pretty well regulated, it's what we consider creditable coverage, which means it's as good or better than what Medicare would offer you. And as long as you have that coverage through your own employment, or maybe a spouse is working and you're covered by your spouse's insurance, you're probably pretty good, and you don't necessarily have to get Medicare at 65 if you still have that type of coverage. But it's always good to kind of check it out as well. Let's take a look at what you could get under Medicare, and then you can compare that cost to what it costs you for your employer-based or your spouse's employer-based coverage. And so Medicare Part A generally covers 100% of the inpatient hospital. Again, you break your leg, you go to the hospital, all those kind of services within the hospital there is generally covered by 100% for days 1 through 60. That's after a $1,632 deductible. And then if you had to go to a rehab facility, like a short-term rehab stay, that is covered in full for days 1 through 20. But then after day 20, it's a $200 per day co-insurance. It can get pretty pricey pretty quickly. And again, your supplemental coverage will cover either that in full, part, or it may not cover any of it. Those are the types of things you need to know about. And then again, it covers some home health care services and hospice care if ever you needed that. Medicare Part B, it does have a monthly premium. The monthly premiums is based on your income from 2 years ago. So if you were working full time, you had a decent income, your first 2 years of Medicare Part B premiums may be higher than the standard premium. The standard premium for 2024 is going to be $174.70. If you're still working and you're getting Medicare Part B and you're not yet collecting Social Security, you're going to have to pay that every month. If you are collecting Social Security, generally the best advice is have that standard premium deducted from your Social Security premium, your Social Security payment every month. That way you'll never forget it. The government takes it out automatically and pays your Part B. I've seen too many people get into canceling it or forgetting about it and lose coverage, and it can be a real headache to try to get it back. Medicare Part B has an annual deductible of $240. That's just an annual thing. And again, some of the supplements cover that in part or in full. And again, generally covers about 80% of the cost for these Medicare Part B services. And again, beware the late enrollment. It can get very pricey. I don't think I put in that slide, but if you want to talk to me about penalties, it just, trust me, it gets very pricey. So you want to make sure, if you should be on Medicare A and B, make sure you sign up during that time period, either when you're 65 or when you retire or you give up other health insurance. That's your open enrollment period to get into Medicare, and make sure you understand things before you let it slide. Medicare Part B. Yeah, you definitely need Medicare Part B if you're going on Medicare. Let's see. Yeah. Again, like I said, compare it to other options you have, maybe through work or spouse. But again, if you're retired or you're otherwise unemployed, more than likely Medicare A and B are in your future. So these are just some costs. These are rough estimates. So you can see Medicare Part A, typical, there's zero premium for Part A, $174.70 for Part B. Part C, that's just a national average. There are some that are zero, and there are some that are far more expensive than the $35. And co-pays for prescriptions and the like, this is minimal. It's just hypothetical average, $35. So you can see about $240, $250 a month, but this is just a hypothetical. And then you have employer-based, that's an average $645 a month average. That's a national average for employer-based premiums. You get co-pays of some $200 or so. And so you're looking at, they're some $845. Not always the case. Sometimes employers are very generous and you get a good package. Sometimes they're very stingy. You may think you have good coverage. You should at least compare it to what your cost would be under Medicare. Okay, Medicare Part B, again, so it covers doctor's visits and other healthcare providers, like if you're going to go see an allergist or a cardiologist or your primary care physician. Outpatient care, like that PT or OT, things like that. Preventative services, physical screenings, vaccines, and durable medical equipment. It either will pay for it or allow you to rent it. Things like wheelchairs, walkers, and things like that. Okay, here's the penalty here. So let's see. Yeah. So if you do not sign up for Medicare Part B when necessary, you'll get a penalty, and that penalty sticks with you for the rest of your life. So it's a big deal. It's an additional 10% of your calculated monthly Part B premium for every year you are late. So if you're 2 years late, you'll have a 20% penalty. So you're looking at your premium, instead of being $174.70 a month, you're looking at $209.64 a month. And that's just for 2 years. So you can see this jumps up, quite a bit every year. Don't want to have to incur that. And again, that's a penalty you pay for the rest of your life. So it's good to be aware of what you need and when you need it. Some people, so I don't want to spend too much time on this part. IRMA, I can never remember what the heck this stands for. Income related monthly adjusted amount. So if your income, you can see here, so if you're an individual and say you were working and you're going to retire, and they base your monthly premium to begin with on your income from 2 years ago. So now we're entering 2024, so they'd be looking at your income from 2022. If you were an individual, you filed individual taxes. If your annual income was over $102.05, you can see here. If it was under that, your premium would be that $174. If your premium was over that, but under $130,000 a year, it jumps up to $244.70. Likewise, if you're filing jointly, these are the income guidelines for that. And you can see that, as your incomes go up, the prices of that premium go up quite a bit. And this can be affected. So if you have like a large retirement account or something like that, and you happen to liquidate it because you wanted all the money all at once, that's going to be counted as income. That's going to push your annual income amount, your taxable income amount up quite a bit. And you may see a jump in your premium. But again, those premiums are counted on 2 years prior. So if it's a one-time jump in your income, you may get those higher premiums for 1 year, and then they'll go back down again based on your baseline income after that. Don't want to get too much into that. If this is something that may impact you, again, I'll give you resources of somebody you can talk to about specific details for your own situation. So let's see, Medicare Advantage, Medicare Part C. So these are Medicare approved plans, and they're offered by private insurance companies. So you have to understand that when you're getting a Medicare Advantage plan, you're getting it through a private insurance company. This isn't the federal government. This is Uncle Sam who's got his arm around you and is looking out for your best interest. These are private plans, whether they're for-profit or not-for-profit. They are private insurance companies. So just beware of that. Most of these plans are considered HMOs or PPOs, again, preferred provider organization. It means you have a network. HMO stands for Health Management Organization. So they are managing the resources to provide you with care. Some of them do that very well. Some of them do a better job of managing the money for their own profit, unfortunately. Pardon my sarcasm. Generally, these types of plans, they have monthly premiums, they have co-pays for different services, they have deductibles, usually like an annual deductible. You pay a first, $200 or $500, and then they have various out-of-pocket limits as well that are important to understand. And again, we'll get it a little bit more into that. And again, most of these plans use managed care networks. So that means that if you join a particular plan, there are particular doctors that belong to that plan and particular health facilities that belong to that plan. So you may see a particular doctor, and you may be able to go to particular hospitals or clinics that are in that network. If you choose to get your care outside of one of those, you can pay quite a bit more. You have to be aware of that and your network. So my advice usually is if you're just starting out and you're picking out trying to pick out a Medicare plan, I think there's about 44 or so different plans that you could pick from. The way to narrow that choices down, if you have a doctor and you want to keep your doctor, call the doctor's office and find out of all of the various HMOs and the Medicare Advantage plans that they accept. You want to know which ones they accept. So out of the 44 more plans you get to pick from, your doctor may only accept like 3 or 4 different plans. So instead of trying to figure out the best one of all of those, figure out which plans your doctor accepts, and then find the best one of those that meet your needs and that you can understand the cost of. So you have a much smaller pool to pick from. It really makes it a little easier. If you're going to be shopping for insurance and a doctor, then start with your insurance plans and see what might be work best for you, and then maybe you can find a doctor within that network. So Medigap plans. So what I've been talking about, is the Medicare Part C. These are the Medicare Advantage plans. I apologize, forgot to mention that all of these Medicare Advantage plans also come with prescription coverage built into them. So you don't need a separate Medicare prescription plan. But now, in talking about the Medigap plans, they do not cover prescriptions, and you will need to pick out a Medicare prescription plan to go along with this. So Medigap plans, again, they're private supplemental health insurance. They're heavily regulated by the state. So all Medigap policies in Massachusetts are either a Supplement 1 or a Supplement 1A. There's very little difference between them at all. And all Supplement 1s offer the exact same benefit package. So whether you purchase it from company A or company B, you're getting the exact same coverage. The only thing differs is the price. So you want to be aware of that as well. You must have Medicare A and B in order to have a Medigap policy. Excuse me, there is three of the types. There's Core, Supplement 1, and Supplement 1A. And I have a graph that shows a little bit of the differences of these as well. Let's see. Okay, so the big thing about how these work differently is you don't have any network. It means you can go anywhere to get your coverage, anywhere that accepts Medicare. Most of these Medigap policies will cover national and international travel. So if you're out of the state or out of the country, you don't have to worry about it. You'll be covered. The way these plans work actually is a provider who sees you, they'll send a bill to Medicare. Medicare will pay its 80% generally. That 20% will be sent to your Medigap plan, and then your Medigap plan picks up the remaining 20%. And you don't see any copay or deductibles or anything like that. It covers it in full. And that sounds wonderful, but the catch is that these plans generally are more expensive than the Medicare Advantage plans. But we can look at the cost, and depending on what your care needs are, these plans might actually be more efficient and more cost saving than even a zero premium Medicare Advantage plan. Again, we'll hopefully get into that and you'll understand a little bit better in a moment. So these are the difference between the types of Medigap plans: Core plan, Supplement 1 plan, and Supplement 1A. Just my personal opinion, I don't think the Core plan is really worth the cost. You can see here the things that it covers and the things that it doesn't. It's generally for its cost. I'm not seeing that they're really of any value. I rarely ever advise anybody to get a Core plan. And the difference between Supplement 1 and Supplement 1A is just your age. You can only get a Supplement 1 plan if you turn 65 before January of 2020. If you turn 65 after January 1st of 2020, your only option for these Medigap plans are either the Core or Supplement 1A. Again, we'll get a little bit more into that. Again, I wouldn't really waste your time looking at the Core plans. I just don't see that they're worth the money. Okay. So if you choose a Medigap plan, then you're going to need a prescription plan to go with that. That's Medicare Part D. So these plans, again, they're offered by private health insurance companies. They're regulated by Medicare, but they are private health insurance companies. They have to follow the rules, but they are private companies. And so they work with original Medicare, and if you have a Medigap policy as well. And again, they have late penalty fees as well. So if you're 65 and you're going to go on Medicare, but you're healthy as a horse and you're going to run in the Boston Marathon and you don't take any prescription medications, you might say to yourself, I don't need a prescription plan. I'm not going to get one. Even if you don't have prescriptions, you really should sign up for a prescription plan because there is a penalty. If you were supposed to get a prescription coverage when you're 65 and you don't, there is a 1% surcharge for every month you don't sign up for a prescription plan when you were supposed to. So like you can look here. So if you go 2 years without signing up for a prescription plan, that comes out to be an additional, right now anyway, and this figure changes every year, it comes out to right now $8.30 is going to be added to every month's premium. You can see that's 2 years. I've had people 10 years they didn't sign up for a prescription plan when they should have. So now you're talking your basic monthly premium has doubled, sometimes even more than doubled. And that's, again, for the rest of your life. You just don't want to get into that situation. And again, remember, the prescription coverage is built into the Medicare Advantage plans. So if you choose a Medicare Advantage plan, one of those HMOs or PPOs, you've got prescription coverage built into it. You don't need to pick out a Medicare Part D plan. And it's important to understand that, because if you get yourself a Medicare Advantage plan, and then you see some shiny ad, and some fancy actor comes on and tells you need to get this prescription plan, and then you call and sign up for it, you'll actually be kicked off of your Medicare Advantage plan. So be aware of that, and don't watch television ads. Again, Medicare Part D. So there can be, and I'll show you an example of this, but there can be extreme differences in the cost of the same medication from one plan to the next. There, I think, is about 22 different prescription plans offered to people in Massachusetts. There can literally be hundreds and hundreds of dollars difference in the cost of one medication from one plan to the next. So it's really important that you get professional guidance in selecting which plan is best for you. I'll give you an overview of how you can do this yourself. If you don't feel you can do it yourself, I'll show you how you can get some help to do this. So the Medicare prescription Part D plans, they have three basic costs. Each plan has a monthly premium. Some of those might be zero, but some of them may be much higher. That's just something you pay every month to have that plan. Regardless of how many prescriptions you have, you pay that same monthly premium. Then there are annual deductibles. Again, some of them have zero. Some of them could be as high as $650 a year. And then there are prescription copays. That's the actual kind of percentage of the cost of a particular medication that you may have to pay. Some prescriptions may have zero copays. You got some long-standing generic medications. They may cost nothing. So you have no copays. Some other new tier 3 brand new medication right off the lab, you may have pretty high copays for. And then, to make things confusing, because none of this can be simple, there are actually 4 phases of coverage in your Medicare Part D prescription plan. So you get your plan, it's January 1st, you go down to the pharmacy, you've got a $300 deductible, and the retail cost of a couple of your medications add up to like $600. You're not walking out of there with all your prescriptions without paying that $300 right up front. You pay, you get it done for the year. That's great. You go in February, and you're not paying that same deductible, but you just have to be prepared for that. That's why it's good to get the information on your plan ahead of time, so you're not surprised by any of these costs. You have the initial phase, and that's where your plan is kind of standing by you, and they're helping reduce the cost of your prescriptions. After you and your plan have spent $5,030, you fall into what's known as the coverage gap. Some people call it the donut hole, coverage gap, and all kinds of other names for it. But it basically means that your plan, they're still there with you, but they may not be helping you out as much as they were before. And you'll see some of your medications will go up. To make things complicated, some medications, they've changed. They'll either stay the same. Sometimes they even go down. I haven't quite figured out how that all works yet. It's based on the particular medication and the particular plan. But again, you can find that information out by utilizing this Medicare Plan Finder tool, which I'll show you a little bit, so you can understand the cost. And then after you go through the coverage gap, you can reach into catastrophic coverage. So if you've got really expensive medications, if you and your plan have spent $8,000 in any one calendar year on prescriptions, you now fall into the catastrophic coverage. And generally, in that instance, the cost of your prescriptions goes way down. It doesn't go away, but it gets a little bit more manageable.
Hey, Dan, just quick. I want to just remind everybody we have the chat section open. If you have any questions, just ask away
Okay.
along the way, and I'll interrupt when possible. That's it.
Okay. So that was really quick. I know that your head's probably spinning a little bit, but I'm going to go through an example of how you can get more tailored information to your own particular needs or find resources to get somebody that can help you. So here's some key points to remember.
Dan, I don't mean to interrupt you, but
Sure,
we have a hand raised right now, and I'm looking to see who it is. If you want to unmute, I can't see where it's. We're going to allow you to ask the question, I believe. Oh, Nancy Stone or Dorothy Hines, I believe. Dorothy, you there?
Yes. I just wanted to ask, do you have to keep track of, say, that $8,000 of your copays, or I guess the insurance company keeps track of it?
Generally, yeah. So when you have a Medicare Part D plan, they should send you like an explanation of benefit every month.
Oh, right.
Like,
okay.
Hey, here's the medications you got last month. Here's what we paid. Here's what you paid. And, here's kind of your totals. And in that should be you and the plan have spent, X number of dollars so far this year. So they should track that for you. You shouldn't have to do that yourself.
Thank you.
And I believe we have one more, Dorothy Haynes.
No, that was me.
I'm sorry. We had one more. We did have one more. Nancy Stone, I think, was the one. Okay. Thank you, Dorothy.
Okay. So again, remember, Medicare A and B, they are the core of your health insurance. Once you go on Medicare, they'll always be there for you. Sometimes people think like, oh, well, I've got like Tufts Medicare Advantage. They're my insurance now. I don't have Medicare anymore. It's not. It is Medicare is always yours and it's always there. It's a federal benefit and you will always have it. If you get a Tufts Medicare Advantage plan, they will manage your Medicare benefits, but they don't own that benefit. It's still your benefit. You can change from Tufts to something else. You'll always keep your Medicare A and B as core. So don't ever think that you have lost it or you don't need it anymore because you have some Medicare Advantage plan. So you should never disenroll from Medicare A and B. I don't know of any circumstances why anybody, unless you won the $1 billion lottery, and even then, you should never disenroll from Medicare A and B. Those are always going to be the core once you choose to go on Medicare. I am a skeptic. I'm not a big fan of insurance companies. They provide some wonderful services, but they also find, unfortunately, various ways to confuse people. So don't ever trust any advertisements. They're never giving you the full understanding of the cost and benefits of their services. There are ways so that you can find that out. And so that's what I'm going to show you in a moment. And don't trust your crazy cousin. Just because your cousin or the person you meet down at the Elks, they picked out a plan and they said it's the greatest plan ever. It's probably not the right plan for you. So you have to find the information that is pertinent to you and your needs. And you should review your insurance options every year. They change considerably. If you pick out a plan this year and you still have the same plan 5 years and you haven't looked at it, you're probably paying more than you should. So you should at least learn how to do this yourself or find out where the people are that can help you figure this out. You should review it every year because the costs change considerably. From the lowest cost plan to the highest cost plan, it can literally be thousands of dollars a year difference. So you want to make sure you're getting the best coverage. If you want help with that, there are most communities have availability of a SHINE counselor. SHINE stands for Serving the Health Information Needs of Everyone. And you can find the nearest one to you if you call Mass Options at that 1-800 number. You can also call your local Council on Aging or Elder Services in your town. Most of them will either have a SHINE counselor at their office or they'll be able to direct you to one as well. And then there's also the Pharmacy Outreach Program, They are based at the Mass College of Pharmacy and Allied Health in Boston. And they are wonderful. These are pharmacists or pharmacy students, and they are a wonderful resource. They're great if you've got expensive medications and you're trying to find ways to save money on them, but they can also help you with just your everyday prescription questions and even help you find the right prescription plan. Their phone number is right there, and their website also. And if you're a client of Senior Resource Center, you're welcome to give me a call. And I do this with people all the time. We'll arrange a time to chat and go over a few things, and I can help you figure out which plans may work for you best. And that's what we're going to do now. So I think we got just about.
I think Dorothy had one more question.
Oh yeah, sure.
I do. How do I get my sister so that she can have access to you?
Well, if she's a client of ours, that's wonderful. But if your sister wants to do this stuff, if she just goes to her local Shine counselor, they will do this. The Shine counselor will use this Medicare Plan Finder tool, and I'll show you how powerful that is in a moment. It's really the only way of comparing one plan to the next based on your likely cost. So if your sister's not a client of ours, just have her either contact Shine and find a Shine counselor. They are volunteers. There's no cost to them. They're just, they know a lot of stuff, and they are worth their weight in gold. And they will help you through that.
I've tried.
Go ahead.
I'm sorry. I have called Mystic Valley Elder Services Shine counselors, and they haven't called me back for like weeks. So it's probably because it's Medicare Open Enrollment. But
it could be. It could be. You could try the pharmacy outreach program, but you could have her call me. Just mention your name, and we'll give her a bump up.
Okay, it probably will be me. Thank you.
You're welcome. So again, let's check out this Plan Finder tool. I can figure out how to use my let's see. All right. One second here while I try to figure out. All right, I don't know where my. Nope. Okay. Okay. I'm sorry, I gotta. Sorry, Scott. I was having trouble finding that. Oh, there we go. Okay, so let's take one sec. Can everybody see my screen, Scott? Do you think?
I think so, yeah.
Okay, so here I am. I'm just going into Google here, and I'm going to Medicare.gov. It's really actually an excellent website. It's not too complicated to navigate, even if you're a novice at this. But for our purposes, we're just going to use this thing called a Plan Finder tool. So you see, I went to up here, Medicare.gov. It's the official Medicare website, Medicare.gov. You don't want Medicare.com or something else. It's Medicare.gov. That's the official Medicare website. And then you can go right over here to Find Plans. And you got two ways to go through this here. My advice is, if you haven't already, you should save time and log in, and you can create your own online account with Medicare. So you're putting in your name and your Medicare approval information, your Medicare number and date of birth and things like that. And you can save everything you put in there in your account. And then each year you can just go in. If your medications change, you can just change the medications on your account. and it will give you all the results based on your particular circumstances. That's the best way, I think, to do it. So either you can do that, or if you have a family member maybe that's better at utilizing computer, have them do it. But that's a really good way to do it. If you don't want to enter your own information, then you can just come over here. We're looking for 2024 information. I'm just going to put in Quincy 2169. And continue. There are some differences based on what county you're in. There are different plans that are available in certain counties and not in others. So I'm just using this Quincy. Basically means it's going to cover all of Norfolk and Suffolk County. Excuse me. Okay. So here we're going to click on, we want to look at Medicare Advantage plans. I'm going to find plans. This is, we don't get any extra help. We're just saying we don't get any extra help. Excuse me. Second. Right. And then, yes, we want to see the cost of our prescriptions, and we'll go next. And then you can enter in your medications here. So I just picked a few commonly prescribed medications. I already entered them in here. You just, what you're basically going to do is, let's look at lisinopril. That is a common high blood pressure medication. That's a typical dose is 10 milligrams. You take it once a day, so 30 every month. I'm going to add that prescription to my drug list. If I've got other medications, I'm going to hit add another drug. So I already did that with a number of different prescriptions. And then I picked out a few pharmacies, a CVS, a Walgreens, and mail order. And then here's the list that was generated from that. And you can see there are 44 available Medicare Advantage plans in my general area. And you look on here. So this is for Norfolk County. Again, you look on here on this drop-down menu, it says sort plans by lowest drug and premium cost. You can pick different things, lowest monthly premium, lowest yearly drug deductible. It's best to go with lowest drug and premium cost. And now I've got a list tailored to the medications that I take of all 44 Medicare Advantage plans. Again, this is Medicare Part C. And they're listed by cost, ascending cost. So this one right here, Clear Spring Health Value RX, prescription drug plan. Excuse me. Oh, I'm sorry. I apologize. These are the prescription plans. I'm going to go over here to the Medicare Advantage plans. I apologize. 21 different HMOs and PPOs that are available. And again, lowest drug cost and lowest premium cost. So you see here a whole list of different plans, and it shows you some of the costs associated with it. And then you can dig deep into each plan and find out more information about the various costs and benefits of this plan. So based on the medications that I take, there's about 4 or 5 of them that I put in there, common medications. This is the PPO that comes up as the lowest cost of all of these from me under that. It's Mass General Brigham Advantage PPO. Mass General Brigham is now a huge health consortium. If you're not controlled, your doctor isn't beholden to the Mass General yet, they probably will. They're just gobbling up everything. So you can see them in a lot of communities around here. They provide excellent health. They are a huge company. So more than likely their network is, saturated with plans or facilities that are associated with Mass General Brigham. So you can see in this plan, it's a Medicare Advantage PPO. It has 0 premium. So you don't pay anything every month. So if you're a relatively healthy person, you only have to go see your doctor maybe for a physical and maybe some vaccinations and things like that. You're not going to pay anything for this plan. So that's a great price. And then the different medications that I put in my list, I can expect to pay about $750 for the calendar year of 2024. That's that's the cost out of my pocket. This plan, again, down here, you can see it has no health deductible. So if I go see my doctor, I don't have to pay anything. There's no deductible, and there's no drug deductible. So when I go to the pharmacy, you know, January 1st, there's no deductible for my medications. However, there is a $9,700 in and out of network, out of pocket maximum. That means that any cost that I do incur, whether that's like through prescription co-pays or co-pays for like x-rays or MRIs or different tests or hospitalizations, I can pay as much as $9,700 for the year before my plan will kick in and pay 100%. So say you have some catastrophic health problem, you had some major problem, you had an ambulance ride to the ER, you were admitted for like a week or 2 weeks in the hospital, they ran all kinds of tests, you had surgery, and you went on to rehab, and your cost could have been like $100,000 for all of this stuff. You're going to only have to pay $9,700 of that, and everything over that should be covered under your plan. There will be some other costs, but the bulk of your expenses over that will be covered by your plan. But you do need to be aware that you could pay as much as $9,700 out of pocket. Hope I made that clear enough. It can be a little bit confusing. If you see a real bill, you can see that, like, you know, you pay for something you get at your doctor's, you pay a certain amount, but then they show you, here's what the true cost is, and you have an understanding of what the plan paid as well.
Okay, Dan, we have
Yep.
Bruce Rosette. Hope I said that right. You had a question here?
Sure. You hear me?
Yes.
Okay, my search is complicated because one of my drugs, some plans cover the generic and other plans don't cover the generic, they only cover the name brand. And I've had to build two different lists because of that.
Yeah, so I think you should have a conversation with your doctor to see what's best for you. Should you take the brand name or the generic? If the generic will work fine for you and the doctor feels that it is okay, then go right ahead and you can just put in the generic. I am in similar circumstances. I take 3 different eye drops, and my doctor wants me taking the brand name version because he feels that the generic version is fairly new and it just it doesn't have the same track record for my condition. So I'm taking 2 generics and 1 brand name. So yes, in that instance, I choose to get the brand name. But talk with your doctor. If the doctor feels you're okay with the generic, just go with that.
Okay, thank you.
Sure, you're welcome. So again, here, let's
Nancy Stone also. I'm sorry, Dan.
Oh yeah, no problem.
So I just want to, if I read this slide correctly, it seems like if I was reasonably healthy and didn't have a lot of appointments, but was on some prescriptions, my total cost for the year would be that $754 number.
Well, it would be based on your prescription. So this $750
right.
is based on the meds that I put in there.
Right.
But if you did this yourself, excuse me, went through the plan find, entered your own, you'd get that number.
Yeah. And I don't happen to be on anything, but so I just wanted to restate that. And then when it says doesn't include health costs, that means if you go to a specialist or your PCP, that's what you mean by health costs, right? It's those co-pays and
excuse me. Well, here, I'll get into this a little bit more detail, and maybe that'll explain things.
Okay, and then I just wanted to ask one other question. When you were talking about the networks, I'm new at this, but planning to probably opt for something January 1st. And somehow my understanding a little bit was that Tufts health plan, that network is more like Newton Wellesley, and the Blue Cross Blue Shield health plan, I could be wrong, is more the Brigham network. Is that accurate? Or
I don't think so. Those change, and they can change yearly. So the relationship Tufts has with providers and facilities this year may change for next year. Because what happens is especially the HMOs and the PPOs, they go in with their sales team and they really try to lowball these doctors groups and hospitals, saying like, oh, x-rays, we're only going to pay you this much for these x-rays, so you got to bring down your cost. And a hospital may eventually say, you know what, forget it, we can't meet your cost demands, and we're just not doing business with Tufts anymore. And so Tufts walks away. And now if you keep Tufts, you can't go to that same doctor or that same hospital. So you have to be aware of that. If you do the Plan Finder tool, it will show you the contracts for 2024, but they can change. So you just have to be aware of that. But generally, Blue Cross and Tufts are pretty statewide. I don't think that they specialize in any one particular area, but definitely like this plan here, this is they're new to the game. I believe this year the Mass General Brigham Advantage plans are new to the game this year. Yeah, see, plan too new to be measured. So usually they give like a star rating. Like most of these plans are too new. And that's a big thing. So like Tufts has actually 4.5 stars. They used to be 5-star. I'm not sure what exactly brought them down. And you can see each Tufts has many different HMOs and PPOs to pick from. Like this one, Tufts Medicare Preferred HMO Smart Saver RX. Or you can pick Tufts Medicare Preferred Access RX. They have different names for these plans. But did that help answer?
Yeah, that was wonderful. Thank you.
Okay. So let's dig into just this particular one. This is Mass General Brigham Advantage. Because for me right now, this is my lowest cost plan that they're telling me about. So I can go down here. You can see plan details. I'll click on that. Now I can get much more granular information about the plan. You can see here, again, total monthly premium, 0. Health deductible, 0. Visits to your primary doctor, 0. Out-of-pocket expenses for prescription, estimated about $750 a year. You can see here, again, those are the costs. Again, you have your standard Part B premium, of course, you have to pay anyway. That's that $174.70. No deductibles. $9,700 out of, that's your out-of-pocket maximum. Let's see here. So here's where you get down to more of the nitty-gritty. For healthcare, visit your primary care doctor. No copays if you're in network. If you go see a doctor out of network, $20. If you go see a specialist, so say you go to see a cardiologist, $45 in network, $65 if it's that doctor's out of network. It's important to know what your network is. Then if you have diagnostic tests, again, $20 in network, but look, out of network, it's 40% coinsurance. So if you go and get a $1,200 or $1,000 MRI, you're paying $400 for that MRI. If it's out of network, only $20 if it's in network. So you have to be aware of that. You have to be a smart consumer of healthcare. Again, this plan does that a lot with all of these. Lab services, again, in network, 0 copay. Out of network, 40% of the total cost. That 40% can add up a lot. Diagnostic radiology, like MRIs, anywhere from $75 to $160 copay in network. Again, 40% coinsurance out of networks, and MRIs can get quite expensive. You're looking at thousands of dollars total cost, so you're looking at hundreds or more dollars. Could be out of pocket if you needed an MRI. And then so forth, it goes down there, $90 copay for emergency care. So this is what's wonderful about this Plan Finder tool, is that you can compare plans side by side. So let's look at these side by side. I can choose, let's see, where is, I think I can. If I can figure out where to add that to. What is that? Oh, add to compare. Sorry. So right here on this, I can add to compare. And then let's go down and look at this Eternal Health Forever. I have never heard of this company. They are new to the field this year. They don't even have a Medicare Star. And now I can compare, excuse me, these plans. and now I can go plan details. Why isn't doing the compare? I'm sorry. Sorry. I gotta go to the bottom. Sorry, you have to go all the way down to the bottom here, and I apologize. They changed this on me. I apologize. They seem to have moved the compare button. It used to be a button you hit and it would take you to the plans that they... Okay, here we go. I apologize. Hidden by this screen here. Compare. Okay. Sorry about that.
I do have a question. I think Lou
got another question. Yeah, sorry.
Yeah. I'm just gonna find them here. I think you might have. Yeah, Lou. Are you there, Lou?
No. Yeah.
I think he found what he was looking for, so I think he's all set.
Okay. So again, sorry. So we're kind of running close out of time here. I just want to show you. So you can pick 2 different plans that you're interested in, or even 3, and it'll give you a side-by-side comparison. So this is Mass General on the left, and this is this Eternal Health Forever on the right. And you can go down and see the differences in the different costs. So drug plan deductible for this plan, 0 for the Mass General, but it's $185 for the Eternal Forever HMO. $9,700 out of pocket max for the Mass General, $5,800 for the Eternal. They're similar to the others. Here's some of these other additional benefits that they offer. You can see what they do and don't offer. In-network copays. So this one here, you know, you got a $45 copay for specialist in-network. There's 0 copay. I'm assuming that it's in-network for the Eternal Health Forever. So that could be a big savings if you go see a specialist like a few times a year. Similarly with diagnostic tests, this Eternal is $0 to $10 copays, where it's $20 or even up to 40% for the Mass General one. So you can see here, when you really get into the details, you can find a lot of hidden costs or savings depending on the plan. But it's good to kind of compare these and then look at your own health needs. If you're somebody who maybe has a cardiac problem and you know you're going to see your cardiologist, maybe you need to see them quarterly, and maybe they suggest you get a stress test twice a year, and then a cardiogram once or twice a year. Those things can really add up. So you want to look specifically at these plans to see what those types of things may cost you under that plan. So you have a better idea. You can plan out your health costs for the year. I apologize. We are kind of at 6:30 now. If I could just, Scott, you okay with another 5 minutes? Okay. So what I wanted to show, one of these important things to keep in mind, sorry, let me just get this out of the way here, is these are Medicare Advantage plans. The system, not necessarily Medicare, but all of these insurance companies try to push people into Medicare Advantage plans. And one way they do that is by altering the cost of the medications. So you can see here the lowest cost Medicare Advantage plan. I'm anticipated to pay about $750 a year out of pocket. If I just go see my doctor, have a physical, maybe a couple of shots, and I get my medications, that's what I'm looking to pay. If I chose to get a Medigap policy and get a Medicare prescription plan, no change in medication, just change in plans. I'm going to go over here to the different drug plans. So that was $754. I am now, my lowest cost plan, and is this one even here that's got a really poor rating from Medicare, is the lowest cost plan. The lowest cost plan, those same medications, this is just medications, I'm now looking at paying $1,700 for the exact same medications for the exact same time period. So, that's, a lot more money per year. It's almost $1,000 more a year to get the same medications under this Medicare prescription plan. This is something new just in the last couple of years. You've seen the cost of these medications under these standalone Medicare prescription plans skyrocket. And it's because the insurance plans all got together, and you can just see them. They've just massively inflated the cost of these medications under Medicare prescription plans. So it's something that you have to take into consideration when you're looking at different plans. If you're considering a Medigap policy and getting one of these Medicare prescription plans, Part D, you have to check out the cost, and you have to calculate that into your whole annual cost. And again, if you feel confident, you're pretty computer savvy, you can get on to the Medicare.gov, and you can go through this plan finder tool, and you can find all this information. You can literally spend hours going through all of this thing here, but this is the only real way to figure out which plan is best for you. It's got to be based. You need to compare these plans dollar for dollar, apples to apples. You cannot get any of this information out of a booklet, out of a pamphlet, or some advertisement. This is the only way to really compare the different plans and figure out which one's best for you. And if you can't do it on your own, you definitely should seek the help of a Shine counselor or another professional that can help you with that. So again, I think
we have Dennis, I believe. Yep, Dennis.
Yep, we got another question. All right.
So, and actually, Nancy Stone had a question as well.
Sure.
Hold on, I'm unmuted. I'm looking at the top here, the headline, and I'm noticing that you can do it by drugs, but it looks like you could also have done it by, if you don't want to leave a cardiologist or a primary care physician, you could have done it by providers as well.
Yeah, I haven't usually done it that way, but yes, that's what I meant earlier about, like, talk with your physician. If you want to keep your physician, or you have you should talk with them and say, hey, which Medicare plans do you accept? And they're going to probably maybe 4 or 5 at most. And now you've narrowed it down. Now just focus in on those 4 or 5, see which ones of those really provide you with the best deal.
Right. But I see why you lead with the drug plans, because that's where the major cost is. I'm sure that the providers don't vary that much in copays.
Exactly.
Yeah. Okay. Right. Great.
Yeah,
Thank you so much.
The drug costs are really oftentimes the driver of this. And again, you can literally see thousands of dollars difference. If you enter, if you do take medications, you enter them into the system and then look at your options from the lowest cost plan to the most expensive plan. It literally can be a couple of $1,000s a year. So you definitely don't want to pick out the same plan your crazy cousin has.
Right. Thank you.
You're welcome.
Okay, Dennis has unmuted.
Yes. If you don't take any medicines, what's the best plan?
Again, if you're otherwise healthy and you don't take any medications, you can pick one of those Medicare Advantage plans, the zero premium. There are a number of them. Zero premium. Let me just go back to this screen here. Sorry. 1 second. I think you have this one up, Scott. So yeah, you can look at, any of these Medicare Advantage plans. There are a number of them. Mass General happens to be the lowest cost for this constellation of medications, but Eternal Health has one that's zero premium. Tufts will, is a big provider. They have zero premium plans. And if you don't have any medications, then you've got nothing here. So you could get decent health coverage in case you have an emergency for pretty much almost nothing for the year. If you don't take any medications, you just see your primary care doctor. An annual physical should be zero. You could get any vaccinations like the COVID vaccines if you wanted to, or flu, pneumonia vaccines generally would be covered. You could get all of that for nothing for the year. The only thing you would be paying if you're going on to Medicare is the likely $174 a month premium for Medicare Part B. But that's kind of a sunk cost. I tell people, it sounds like a lot, but you got to factor it in over your lifetime. It's the core of your health insurance if you're under Medicare. So just if you're collecting Social Security, just have it taken out and kind of forget that part.
I think you have time for one more question, Bruce.
Sure.
I have heard some horror stories about Advantage plans. The reality is all those extra services that they provide aren't free. And I've heard stories where people getting MRIs or other tests that are ordered by their doctors get questioned by the insurance companies.
Yeah.
How prevalent is that? I mean, so far, my wife and I have avoided the Advantage plans for just that reason.
Yeah. Well, I mean, definitely, because that's the managed and managed care is the companies manage the money they get from Medicare for their profit. I'm very cynical, unfortunately, but health insurance is really important. It's really important to know it and understand it. But yeah, there are different plans that are, I don't know, for lack of a better word, stingier than others. So it's good to kind of find that out and talk with your doctors about that. It's unfortunate. I mean, some doctors have gotten much better over the years, but when this all started, about 2 decades ago or more, doctors were completely ignorant. I used to have doctors come into my office and sit down with me so I could help them pick out their health insurance because they just don't know anything about it. So they don't know about it for themselves. They don't know what they're advising people to do. The doctor will tell a patient, yeah, go get an MRI, go get this. They have no idea what the costs are or what that really means. So you can't always rely on your doctor. Some good physician practices will have a case manager or a social worker or somebody on staff that knows these plans much better and then can give you some advice. So yeah, you do. It's buyer beware. Like you can see here on this thing here, this whole list of different plan benefits like vision, dental, hearing. Yeah, it's not covering everything. You might get a free pair of glasses at one particular provider that, might be 40 miles from your home. Dental could be just 2 cleanings if you're lucky, or it might be something else. So you really have to kind of dig down into that. And that's where this plan finder tool comes in handy. Again, go to the plan details and really start digging down into what those different costs are. And then if you can anticipate what you'll need, you can talk with the providers about that specifically. But yeah, and that's why I suggest that people review their options every year because things change enough every year. And the plan you have this year might not be the best plan for you to have next year.
Thank you.
You're welcome. Any other questions so far? Or? So, I think this is important. So again, you can get this. I think, Scott, this is going to be on our Facebook page and maybe our web page. But copy down these numbers if you haven't already. The Shine counselors through Mass Options, they'll find you a Shine counselor. I think somebody asked a question earlier that they couldn't find a Shine counselor or get a call back. Call this main number, the Mass Options, and they'll help you find that. And again, the pharmacy outreach program is a wonderful resource as well. All right.
That's it. All right. Well, thank you all for joining us. Dan, thank you so much for your expertise.
Yeah, thank you.
Oh, Dennis maybe has one more at the buzzer.
All right.
Yes. Humana used to cover dental implants. Do you know of any insurance company that covers that? They stopped covering it in 2023.
Yeah, I don't know that particularly. Dental is one of those kind of gray areas that changes so much. I don't even bother trying to keep up with it all. I think I think the best thing to do is, again, talk with your dentist and figure out they should be the best one. Dental practices are usually pretty good at understanding health insurance options, and they can tell you, like, here, this is the best Medicare Advantage plan with regards to the services that we anticipate you needing this year. Like if you do need implants, the dental office is probably the best place to kind of coordinate that with. Again, the open enrollment period for Medicare Advantage is October 15th all the way up to December 7th. And those are for plans to start next year. So if you know you've got some costly procedure coming up in the next several months, it's good to talk with your provider, dentist or medical doctor, and figure out which plan. Because again, you can change plans every year. So maybe you switch to a more expensive plan for 2024 that might actually save you money because it provides certain things that you know you're going to need. And then you can switch back to a lower cost plan the next year if you don't anticipate having those costs.
Thank you.
Okay.
All right.
All
well,
right.
Thank you. Thank you so much, Dan. Thank you, everybody, for joining us.
Yeah,
Thank you.
Thank you.
We are available. We'll have this recording available and on our websites if you have any other questions. Dan's always available here. We're always available here at Senior Resource Center. You can try us at 617-472-6600. And we are available, ready to roll at any point. I give the Falco, I might get so 617-472-3341 is also another number for us. But we thank you for joining us and look forward to any follow-up questions that you might have.